Acute on chronic liver failure is defined as a potentially reversible condition in patients with chronic liver disease with or without cirrhosis that is associated with potential for multiple organ failure and high mortality within 3 months in the absence of treatment. So it is a very quick condition. It's a very scary and lethal one. There is not a single direct FDA-approved therapeutic targeted towards ACLF. Today is that as a clinician, this is, in my opinion, as a transplant hepatologist, one of the greatest unmet needs for a hepatologist and for our patients. So there's no direct therapeutic for ACLF. And so in response to managing these patients with high mortality in the absence of any direct therapy, we just throw the kitchen sink at them. This is an overwhelming slide with lots of text. You're not really meant to read each pieces of text, but how it feels visually to you is how I feel when I walk into a room of a patient with ACLF. It is so overwhelming. We have to manage every organ, and every organ has failed. I have to manage their circulatory system and give them tons of circulatory support. I have to intubate them to protect their airway because their brain has failed. Their kidneys have failed, so we have to put them on continuous veno-venous hemofiltration. We have to sometimes, most of the time I can't find the specific bacteria, so I throw every antimicrobial agent I have on board and fight with the ID docs over it. I have to feed them, and who knows, sometimes I feed them too much, sometimes I feed them too little. It's hard to find the right balance, and it really takes an entire village to take care of them in specialized tertiary centers. What is the end goal of the treatment? It actually is to buy time. And it's kind of sad that's the only thing I'm aiming for right now is, can I give this patient more time to allow the precipitant to resolve? So whether that was alcohol, let the alcohol wash out of the system. Whether that was infection, let the antimicrobial agents treat the infection. Whether that was a bleed, I need some time to stop the bleed. It is also to allow families to say goodbye. This is such an acute illness. Most of the time, they're just not expecting it. Yesterday, they were walking around in their house, and today they're in the ICU completely intubated. And we, most of the time, just have to call the family and bring them in and say, there's a pretty good chance that your family member's not going to make it. And at the same time, to add to the confusion and sort of how terrifying it is for the whole team, we're also preparing them for liver transplant, because some of these patients will make it to transplant. So in summary, ACLF is a highly lethal, resource-intensive condition that occurs in patients with chronic liver disease. Portal hypertension, altered microbiome, and systemic inflammation drive ACLF, and there is no direct therapeutic for ACLF. Liver transplantation, while effective, is limited due to narrow timing, low availability of organs, and poor access to this high level of care. Thank you very much.